I started with PhysioAge 5.5 years ago now. And my practice is focused on functional medicine and anti-aging. My patients have been quite impressed with the granular detail that we can obtain from biomarker studies. And quite frankly, it's the only legitimate way that you can actually measure the efficacy of treatment programs. So I've been pretty thrilled with it. When I was at the Cleveland Clinic, I was their founding medical director. I did the annual conventional medical. And what I found is that after I saw patients 2 or 3 years, I really got the sense that I was taking a snapshot of a slow motion plane crash. They were always a little bit worse the following year. They might get better for a few weeks or months, but then you'd see them once a year and it didn't have much of an impact. With PhysioAge, they can actually see a quantifiable number, kind of like an aircraft's altitude. And so the analogy I use is that you might still be flying, but how much altitude are you losing? And when are you going to have an event? And most patients really only become interested in their health when they crash or they hit something, and not while they're flying. So for me, PhysioAge has become kind of like a radar, kind of like an air traffic controller where I can monitor their altitude year in and year out. And it's very compelling. And especially because the therapies are working, patients really feel confident that they're doing something that is making a difference in the future. The technology that goes into PhysioAge is actually much closer to what I would call a research level in the case of cardiology practice. And it also is very useful with respect to monitoring the effect of different medications if you have a patient who truly is hypertensive. So for example, when I put patients on medications or on supplements, you can actually see their aortic pressure decreasing. Whereas if you use, for example, beta blockers or diuretics, sometimes you get paradoxically a worsening of their central aortic pressure. And these all are clinically relevant and salient points that patients really deserve to know, and we should be paying attention to. But I think the key is that PhysioAge represents a tool for any functional doctor that's evidence-based, it's biologically sound, and it changes as a function of therapy. So it really does reinforce the notion that we can change the health trajectory of patients, and it's quite a unique tool. I think that every patient is different when they are given health information. And you see the whole dynamic range from people who, for example, if they have really good numbers, they're generally very pleased. Yep. And interestingly, it's not like they give up on their lifestyle. It is one of those unusual tests where if you have a good test, it's almost like wind in the sails, and it gets people to want to actually maintain their functional capacity, actually improve on it. So they tend, to walk away from the assessment with some real inspiration. The ones who have abnormalities, it depends a lot on their personality, and I think this is where our skill as clinicians becomes paramount. Patients will sometimes think of a biomarker of aging as a sign of disease. And so when they're alarmed, I find spending a bit of time with them and saying, look, you're still flying, you still got some altitude, and what we can do is we can change your trajectory before you get a disease. If they accept that, then they often walk out and they're very motivated, and they're very much committed to making the changes, and then relieved when they see the changes in their follow-up reports. I have clients now that have had 4 or 5 PhysioAge, and it's interesting that they are actually more interested in the PhysioAge results than in a lot of the conventional tests. Because conventional testing, you're either sick or you're healthy. They don't quantify it. It's right. A threshold diagnosis. Whereas PhysioAge is quantifiable, so they can actually see changes evolve over a period of time. And I find that just puts more wind in their sails and makes them, really committed to long-term change. And quite frankly, I've never seen that with a clinical tool before. After spending 31 years jump-starting bodies and sewing up screaming human flesh in the Emerge, I can tell you that 80% of the patients I saw in the Emerge had preventable disease. And most of them were surprised. They said, why did this happen all of a sudden? Well, as a physician, this is a very compelling reason to get people aware of what's going on long before they end up in the Emerge or worse. So PhysioAge is a really powerful tool that helps to give confidence to the physician and to the patient that we're heading in the right direction.